Hi, I'm Dr. Firas Nakshabandi, founder and CEO of Empathic Residence and a board-certified child and adolescent psychiatrist practicing here in Chicago. A lot of parents I see often wonder, what is ADHD? Is it a medical diagnosis? Is it a disorder? Is it even real? Unfortunately, there are a lot of misconceptions about what ADHD is and what ADHD is not. So let's start with what ADHD is. ADHD is in fact a real medical condition, and it's one of the most studied medical conditions out there. According to the CDC, about 11% of children in the United States have ADHD, and it is a real condition. There are a lot of imaging studies that actually show the differences between brains with people who have ADHD versus those who do not have ADHD. And there are differences particularly in parts of the brain responsible for doing different things. For example, the parts of the brain responsible for what we call executive functioning, which is the ability to which includes the ability to inhibit yourself from doing things impulsively. Unfortunately, there is a misconception out there that ADHD isn't a real diagnosis or a real disorder, and that it's just an excuse either for doctors in collaboration with Big Pharma to sell medications, or that it's just a term teachers and parents came up with to describe what are basically lazy students. This is of course false. This is another very common misconception about people with ADHD. People with ADHD aren't lazy, they just have very specific problems in very specific areas, including the ability to concentrate and focus on tasks that they don't find stimulating. And that's a key difference. One of the other, misconceptions that happen is that people with ADHD, this is partly due to the term attention deficit hyperactivity disorder is actually probably not the best description of the disorder. It's not that there's a deficiency in attention. People who have ADHD do have attention. The problem is keeping that attention focused on one thing long enough to complete a task. So often parents of kids with ADHD don't think their kid has ADHD because they might be able to, stay engaged playing video games for 2, 3, or 4 hours at a time, which, obviously does demonstrate that they do have the ability to focus. The problem is people with ADHD have a problem focusing on things that their brain doesn't find stimulating enough. Which brings us to another common misconception about people with ADHD is that, it's a problem with discipline and all they have to do is just apply themselves, and if they just apply themselves and sit down and focus, then they would be fine. Unfortunately, that's not the case. Whereas most of us might have at one time or another been easily distracted or have had trouble focusing, people with ADHD have a persistent pattern of that being a problem for them pervasively. So this is always a problem for them when they're trying to focus on a task that they don't find stimulating. Another misconception about ADHD is that it's a phase and then kids eventually grow out of it. This isn't true either. In fact, the majority of kids do have ADHD that persists into adulthood. So a majority of people who have ADHD as children can have symptoms that persist into adulthood, although more commonly the hyperactivity might subside due to a combination of factors like being able to manage it better. The inattention specifically may persist into adulthood. A particularly important misconception that people have about ADHD is that ADHD medications can cause drug abuse. This is a tricky one because most of the drugs that we use to treat ADHD are what we call stimulants. So stimulant medications can be abused by people who are predisposed to abusing substances. So just like people can abuse alcohol, people can abuse benzodiazepines, Valiums, Xanaxes, uppers, downers. There's also potential for these medications to be abused. However, these medications, when taken as prescribed for people with ADHD, this actually reduces the risk of people with ADHD developing a substance abuse disorder. So, in other words, people with ADHD treated with stimulant medications are much less likely to abuse other substances than people who are not treated with stimulant medications or have their ADHD treated. One theory as to why this is part of ADHD is impulsivity. So people who are impulsive and novel seeking and are always looking for something to stimulate them might be more susceptible to trying drugs to get that high or to get that novel experience as a result of the impulsivity. And if the impulsivity is treated, this would act as a protective factor against them abusing other substances. Well, another misconception people might have about ADHD is that people who have accommodations at school have an unfair advantage over other kids who don't have those accommodations. To that, I think it might be helpful to realize that ADHD is really kind of like, having ADHD is kind of like, there are some similarities between that and needing glasses. So if you have problems seeing without glasses, using glasses doesn't give you an unfair advantage. You can't see properly without glasses. So the same thing, we can say the same for people with ADHD. They can't properly focus. They need longer. They might need a longer amount of time to complete tasks. They might need a little bit more help in specific areas to level the playing field. In fact, I've heard a lot of kids that have tried stimulants for the first time describe the experience of having a stimulant for the first time like having eyeglasses for your brains. They say that it's a tremendous difference between being able to. It's a tremendous difference between how they struggled to complete simple tasks before, and the difference after using a stimulant. Other common misconceptions about ADHD is that it's caused by different things such as too much sugar or video games or by bad parenting practices. And the answer to that is ADHD can be caused by a number of things. Specifically, there have been a lot of different genetic factors that have been identified that predispose people to develop ADHD. In other words, it can run in families. But just having too much sugar does not cause ADHD. It can make ADHD worse, possibly. Just like, certain parenting techniques can also make the symptoms of ADHD worse, but it doesn't cause ADHD. A problem a lot of kids have with ADHD with their parents is that the parents are so frustrated trying to get the kid to do what they want them to do is they might resort to things like spanking or physical punishment, which again only makes the symptoms worse. A lot of what we do here is help the parents try and navigate and figure out how to deal with kids who have ADHD. A lot of it has to do with structure, clear, concise instructions, and along with other kinds of therapy. So think about a lot of the things that people with ADHD have trouble with, and it gives you a picture of where issues can become where things can become an issue at school or at home. People with ADHD often have trouble with prioritizing or time management, or staying awake or falling asleep, or regulating their emotions, or transitioning between tasks, or problems with their working memory. And these are very specific problems, and this is the kid you'll often hear has so much potential, but if only he applied himself or focused. And it's not that people with ADHD necessarily are not intelligent. It has nothing to do with that. That's a separate topic. It's that they have specific problems in these specific domains that we talked about. And speaking again about the issue of focus, this can be very misleading to people, again, because it's not that people who have ADHD can't focus, it's that it's a very specific kind of thing that their brain needs to stay stimulated to stay focused long enough on tasks. So if something is engaging or interesting, they can actually hyper-focus on things for long amounts of time. Things that they find challenging also, importantly, can keep them engaged. They often get bored quickly if the class is going too slow, if the pace is too slow for them, or if it's boring in the sense that it's not stimulating to them. They can also sustain focus if the material is novel or new. Often people with ADHD are the people who are constantly seeking out new things or learning new experiences, because they get bored of one thing and then they shift to another thing, and then they shift to another thing, and then they get bored. So this is something that's common in people with ADHD. Another problem that people with ADHD often face is they procrastinate because for whatever reason they have trouble with time management, and it takes them getting close to a deadline for them to be able to apply themselves and focus long enough to finish their task. Unfortunately, this might work initially when you're a child, when you're in elementary school, but as you progress academically, this becomes more and more of an issue. And finally, the biggest misconception people might have about ADHD is that these people just they're bad people, or they're bad kids, and they won't ever amount to anything. And this is, of course, completely untrue. So ADHD, in fact, can be thought of as a specific set of traits that people have. Whether you want to consider this a disorder or not depends on what the context is. Per the DSM, something is considered a disorder if it interferes with your ability to function, socially, academically, at work. If this is getting in the way of you functioning properly in society, it's termed a disorder. One can argue philosophically, however, that the problem might be just the way society is organized today compared to how society might have been thousands of years ago, where ADHD traits might have actually been a benefit to people. So if you think about it, people with ADHD are often people who think outside the box, who have a constant stream of thought that's just floating from one thing to another, and are easily distracted. So if you think back, thousands of years ago, these people had an advantage, evolutionarily even, because these would be the people who are constantly attuned to danger, changes in their environment. They would be the people alerting others to the existence of danger around them. They'd be people who can adapt easily to challenges because of how they think of certain situations. So to answer the misconception that people with ADHD don't actually amount to anything, there are a large number of celebrities and famous people who have come out publicly and stated that they actually have ADHD through interviews or other means. And perhaps the most famous of these is the famous entrepreneur, Sir Richard Branson, the founder of Virgin. He has his own airline. He sent people out to space. He stated that he has ADHD. Other people, such as Michael Phelps, the famous Olympic swimmer, has multiple gold medal wins, and he's also stated that he has ADHD. So if you think about these people, they perhaps they've used particular traits of ADHD to their advantage. If you think about it, what are things that people who have ADHD, what are some things that they're good at that might be an advantage to an entrepreneur? Well, they often think outside the box. They often are able to tackle things in a way that other people might not necessarily think of. They're often very creative people. People like Michael Phelps might have perhaps used his hyperactivity and channeled it to athletic endeavors. I'll often tell parents of kids with ADHD to consider enrolling their kids in a martial art. Not only does it teach discipline, it's also an outlet for all that energy that they have, that can also be very productive. And speaking of entrepreneurs, People with ADHD are 300% more likely to start their own business or be an entrepreneur than people who don't have ADHD. There are other very creative people who have ADHD that include people like musicians like Justin Timberlake, or actors like Jim Carrey, or comedians like Jim Carrey and Will Smith. Speaking of comedy, what makes something funny, right? So something is often considered funny if it's, or the ability to make people laugh is often comes from thinking about an everyday thing, but thinking about it from a different perspective. So that might be considered relatively easy for someone with ADHD who thinks outside the box. It might be a little easier for them to come up with material that might be considered funny. And of course, Adam Levine is an extremely successful singer. He's a lead singer for the band Maroon 5 and a coach on The Voice. And he has also used ADHD to his advantage, perhaps one might say. So these are all people who I would think did not just thrive despite having ADHD. They might possibly have thrived because of components or elements of ADHD that they use to their advantage. It's just a matter of they've found things that work for them. The question inevitably becomes, is this something that needs to be treated or not? Well, that depends on what the goal is and how much of how severe, just like everything else, there's a spectrum. There can be mild symptoms, there can be severe symptoms. How much is this interfering with everyday life? How much is it interfering with the goals that you've set for yourselves? That'll determine, whether you would treat it or not, and what kind of treatment to use. Would you use medications, behavioral therapies, both? What you would do about it? That's something that I discuss with everyone, depending on what it is that they're trying, what kind of goal they're trying to achieve. There are a lot of great resources available for people who want to learn more about ADHD online. I have links to some of those resources available on the website at Empathic Resonance. I hope you found this useful, and thank you very much.